I do think theranostic approaches are a very exciting approach to patients with difficult to treat malignancies. Probably the best example that we have so far is in terms of prostate cancer with lutetium labeled PSMA. That has shown to improve outcomes dramatically for patients with advanced prostate cancer that has already progressed after a number of prior lines of therapy. And that paves the way for testing this strategy in other difficult to treat cancers. The reason that it's an attractive approach is because it doesn't depend so much on the properties of the tumor as much as it depends on the expression of a specific marker on the tumor that can be bound to, and then just whether that is a tumor type that responds to radiation. And so it's a very exciting approach, one that's already paid dividends in malignancies like prostate cancer, and we're hoping to bring it to the forefront of treatment for kidney cancer. Yeah, that's a great question. So the advantage of CA9 targeting treatment is that CA9 is expressed on over 90%, probably almost 95% of clear cell kidney cancers. Clear cell is the most common type of kidney cancer, making up roughly 75 to 80% of all cases. And we know that, again, the expression of CA9 is nearly ubiquitous on these clear cell kidney cancers. And so it's also not expressed on most normal tissues. And so it offers a therapeutic window and a high therapeutic index where we can target something that's specifically on the cancer and not on normal cells, allowing us to deliver a anti-cancer treatment that should have not so much in terms of toxicity on the normal cells, since they don't express CA9, but just have an impact on the cancer cells. And so it's been a strategy that we've been interested in for clear cell kidney cancer for a long time, and happy to see that this is now becoming an approach that's being tested in clinical trials. Well, I was really impressed with the significant uptake in terms of, one of the common ways that we measure the uptake on PET scan imaging is with the SUV. And in particular, the SUVs were very, very high in the tumors with this agent. So I think the median SUV was in the 60s, and that's extremely high. When we use FDG PET, which is essentially a radioactive form of glucose labeled PET scan, it's rare that we'll see SUVs even above 20 or 30 as the maximum of what we see, and to have a median of 60 is really remarkable, and that signals how much of the agent is being taken up by the cancer cells. And so the more of the agent that's taken up by the cancer cells, the greater the potential for activity of the theranostic agent, of the lutetium labeled peptide. I think there's several potential applications for the diagnostic component of CA9 labeled approaches. So for one thing, in patients who have who we think have localized disease, it's possible with a more sensitive diagnostic modality, such as the gallium labeled CA9 PET scan. So that's one potential application. A second potential application is that in patients who have metastatic disease, we might increase the number of metastatic lesions that we see, and therefore be able to better follow patients who are receiving treatment for their kidney cancer, even if it's not the lutetium labeled or CA9 binding cyclic peptide, even if they're receiving one of those other three categories of drugs that I talked about, the anti-angiogenesis drugs, the immunotherapy, or the mTOR inhibitors. It is possible that we'd be able to better follow patients, know that if there's one or more lesions that are progressing, that we might not be able to appreciate with less sensitive modalities. And certainly that could be a benefit in terms of picking up patients with or metastatic sites that are getting worse before the patient develops symptoms. So those are just two of the potential applications. There are additional ways that this could be helpful in terms of evaluating response, and of course in identifying patients who would benefit most from the therapeutic arm of this approach with the lutetium labeled CA9 binding cyclic peptide.